Hello? No, I can't come out right now. I have another appointment in just a few seconds. I'll be able to call you back once I'm done though, and I'll probably be able to come out for a little bit and get the groove on. You know how I like to do. Actually, I think my appointment is here now. Hold on a second. Who is it?
Melina and Oliver.
Yeah, my appointment's here. I'll call you back. Come on in. Hey there. So Melina and Oliver, yes?
Yes. Yes.
Excellent, excellent. So I was very surprised to get your call. Me being a thought form and all, I don't usually get hit up for consultation services. But I was getting a little bit of your backstory from Melina, and I think that a thought form STI counselor might be the perfect one for this particular relationship configuration. So do one of you want to start off by telling me what brings you in today?
So I'm Melina. I am a clone from the flesh pits of the outer world.
Mm-hmm.
And I was created at the behest of Shao Kahn to be a kind of sister, but really a spy for Princess Katana. And my life has just been full of abuses. And I left once I found Oliver in one of the tournaments because he just kept taking the hits and he didn't die. So I came back to Earth with him. But we're taking the next step in our relationship, and there's these words being thrown around that we don't have them in the outer world. So what's this symbiotic relationship that you humans have with bacteria, like what's that one called, Oliver? Chlamydia. What is that, like a dog?
Gotcha. So you, being from out of town, being from the other world, have no understanding of what it's like to have like physical human world earth realm sex.
Not earth realm, but outer realm, yes.
Okay, gotcha. And for you, why'd you come?
My name is Oliver. I own a dojo. I don't even know how I managed to survive, but I did.
So you managed to live through the last Mortal Kombat tournament.
Yeah.
And as a result, you managed to link up with Melina here, and y'all two were deciding you're gonna give it a go.
Just amazing.
Yeah, he has no complaints about how wide I can open my mouth.
Deep throat.
Excellent. So it sounds like the two of you are starting to figure out some of the things that make you compatible sexually. That's excellent. And I'm also hearing that you've got some concerns about STIs, sexually transmitted infections.
Yes, those.
Absolutely.
They're not dogs.
They are not dogs.
So we don't want to collect them, because I like dogs a lot. They're very loyal.
So whether or not you want to collect STIs is your business.
Is it like that Pokemon that I keep hearing about?
No.
Oh.
But you know, with illnesses like the clap, at some point, your doctor is just going to start calling it the applause.
Oh, interesting. Okay.
So I can start off by giving you both some preliminary education about sex. Have you two started talking about how it works between the two of you? How much exploration have you actually done?
Well, I mean, I was made in a flesh pit.
That doesn't work like that here. We
Mostly
actually
just hand stuff.
mostly just hand stuff.
Yeah.
Yeah.
All right.
And no stuff.
Yeah.
Hand and mouth stuff. Excellent. And so a lot of the questions that I'm going to start asking you are going to be very personal questions. However, the stuff that we talk about is confidential, and I do ask them of everybody. It helps me get a realistic idea of what your risks are and some of the things that you might want to do to mitigate your risk while also engaging in some happy, healthy, exciting sex while you wait your test results. Sound like a plan?
Sounds good.
So when it comes to STIs, and for this session specifically, we're talking about HIV, chlamydia, gonorrhea, herpes, syphilis, and the human papillomavirus. And so those will be the ones that we're covering in this particular session. When it comes to STIs, we got them in two forms. Well, we got them in a few forms, but the two forms that we're going to be talking about are bacterial and viral. So chlamydia, like the one that you heard of, is a bacterial infection. However, HIV, human papillomavirus, and herpes are viral infections, meaning they're caused by a virus, not a living entity like a bacteria.
Which one's worse?
You don't want any of them. The ones that are bacterial are curable. The ones that are viral, you have them for life. And so as an immortal, that's a really long time.
Yeah, and I like to have lots of sex. So
It's interesting that you would bring that up. Are you comfortable sharing about how many partners you've had in maybe like the last 90 days?
well, I've been in this earthly realm for maybe about a year now, and I've only really been with Oliver, and that's been in the outer world, like, okay, yeah. But here it's only really been Oliver. Other people don't like my face,
Gotcha.
the mouth thing, you know.
Gotcha. It takes a special kind of person to understand what kind of gift that is.
Yeah.
I'm here for it. Yeah. And how about you, Oliver? About how many partners have you had in the past 90 days?
About 90.
About 90.
Yeah, he promiscuous. I like it. Sometimes he lets me watch,
Hey.
but I have to keep the mask on or else they get scared.
It's okay.
That was very supportive of you. Good job. Good job. So, with a larger number of partners, there's more increased risk. So, and if you don't know the status, either whether or not they're positive or negative for any STIs, if you don't know their status, your risk goes up a little bit more. So, the ones that are curable, the bacterial ones, gonorrhea, chlamydia, syphilis. Got it? Where are they?
Gonorrhea, chlamydia, and syphilis.
Yes, those are the bacterial ones, and you take those. And should you come into contact with one, and should you contract one, you can cure it with an antibiotic. So you can either get a shot, take a pill. Unfortunately, there's no sex for 7 to 14 days once you're on a regimen of antibiotics, but that will usually clear up any bacterial infection. There is the emergence of some penicillin-resistant gonorrhea, which is causing a problem. However, that is not really a concern right now in this session. And medically speaking, there are types of antibiotics, specifically cephalosporins, that do still treat the resistant strains of these bacterial infections. The ones that are more intense, the ones that are chronic, that keep coming back, are the viral ones. And that's the HIV, the herpes, and the human papillomavirus. HPV, human papillomavirus, is broken up into strains or risk types. So you've got high risk strains and you have low risk strains. You don't want either risk strain if you can help it. However, it is so common that it is kind of unavoidable, because the interesting thing about herpes and human papillomavirus is that you can transfer them from skin to skin. So you don't need a fluid exchange like you do with the bacterial ones or with HIV. So you can pass them along through oral sex. You can pass them along through heavy petting and frottage and grinding. You can pass them along rolling around in the bed if you have an outbreak. Symptoms for HPV do include warts on the genital region or where you come into contact with the virus. So example, you, Oliver, might have actually noticed, growing up, there are kids with like warts on their hands. It's the same virus. HPV leads to warts. You can get them on your genitals. And they are painless, fleshy growths. Treatment-wise, you can get them frozen or burnt off. You can get them inside your anus, in which case you would have to go to a medical professional, a nurse practitioner at a clinic, and they can cauterize those and get those off for you. But they do keep coming back. And you can pass it on even if you don't see a wart on one of your partners, which is why it's one of those things that you can't necessarily avoid with some of the barrier methods like condoms or dental dams. And the only way to make sure you're not getting it is sexual abstinence. It's the same thing is true for herpes. However, if you are not the kind of person who will realistically commit to abstinence, then the next bet is a barrier method. So if there is a barrier like a condom or a dental dam between a viral infection like an actual wart or an actual herpes sore, then you will not transmit it, right? So it's kind of like how if you put your hand in a garbage bag to pick up dog shit, you don't get the dog shit on your hand. That's kind of like what we do with condoms, right? Like if you put one on, or if you're wearing one, two types, male condom, female condom. If you're wearing one, then anything that's on those genitals, on the surface of the skin, you are protected from. Any questions about barrier methods like condoms or dental dams or HPV?
No, I think we're good.
It seems pretty straightforward.
High risk strains for HPV are the ones that lead to the cancers: anal cancer, cervical cancer, throat cancer, oral sex. So there's a risk, correct? Correct. And so fear not. So for you, Melina, who has not had very many Earth partners, maybe not so much for you, Oliver. However, there is Gardasil, a vaccine that does protect against many of the high-risk strains and the low-risk strains for HPV. That does offer some protection. That might be something that you both want to consider. Your doctor might not give it to you, Oliver.
Why not?
So once you've had a certain number of sexual partners, like 8, or you've reached a certain age, like 8. So 8 is a sarcastic response because like I don't necessarily agree with it. But like usually after the age of like 25, they don't give it out anymore. However, your primary care provider might be so persuaded to do so, depending on what your clinical makeup is and what your needs are. Do each of you have primary care? You don't look like the kind of person who's ever visited a medical professional, actually.
I'm a clone from a flesh pit. I don't get sick. But now I'm on Earth and it's weird here. So
Yeah,
maybe.
So when in Rome, go ahead and get yourself a primary care provider.
What's Rome?
An idiom.
Is that an insult?
Yeah. I'm glad you two have a sense of humor. Makes talking about awkward things a little bit easier.
Mm-hmm.
When it comes to herpes, 2 types. Herpes simplex virus 1, herpes simplex virus 2. If you break the human body in half, which something you might have experience with.
I like doing that. Are we gonna do it?
No.
Oh.
But if you break the human body in half at the abdomen, laterally, herpes simplex virus has a tendency to show herpes simplex virus 1 has a tendency to show up at the top, right? So it's the mouth area and in the nose. And then herpes simplex virus 2 is the bottom half of the body. So that's the genitals, like the penis and the vagina. Speaking of genitals, can I ask about those for you?
Oliver tells me I've got a nice poontang.
Okay,
And then he tells me my second one's really nice too.
2 of them.
Yes.
Excellent. And are you comfortable utilizing both?
I mean, I have before,
Excellent.
just
Excellent.
not quite here yet. It's like I said, it's kind of weird here in some ways.
Mm-hmm.
I don't have to always fight for dominance. He just rolls over for me. It's kind of nice.
So you were finding that some of the men here in Earth Realm don't put up much of a fight towards you?
No, they don't. I think I scare them.
It is what it is, right?
The mouth thing, yep.
It is what it is.
They're missing out. That's all I'm gonna say.
More for me.
Yeah, yep.
More for me. Got it. So for you, biologically speaking, you're going to want to make sure that your vaginas are protected. And so historically speaking, we have done a lot of things to protect that area. So historically, our primitive mothers used to stuff leaves and dirt up there to make sure nothing got up there and pregnancy wouldn't happen. So by the way, I know that you were cloned in a flesh pit, but pregnancy is a thing that happens here on this planet in which female partners actually grow the next generation of human from their bodies.
This is what you were telling me about? So they're walking flesh pits.
Yes. Also, incubator is appropriate.
Okay.
Living test tube.
Oh.
Petri dish. Remember, I'm a thought form. I don't take offense to any of these.
Okay.
Actually, as the only Petri dish in the session, what do y'all like to go by?
I didn't really think about it.
Back on the session. Herpes is painful. It produces open sores and lesions on your genitals and in your mouth. And when those are present, you absolutely can pass on the herpes virus. Also, when they're not present, you can be going through what's called viral shedding, and you can still pass along even when it's not there. And so that is also something that the two of you would want to kind of talk about and consider. Any questions about herpes?
This shedding, is it visible like a dog
No.
that sheds? No.
No.
Oh,
Nope. All microscopic things happening in and on the surface of the human body.
nothing is like dogs. Okay. Just wrapping my head around that.
What dog is most delicious for you?
Oh no, I actually like them. Like not to eat, like to snuggle. We don't have dogs in the outer worlds that are nice to play with, and the ones here are very lovely. I like dogs.
Chihuahua is most delicious for me.
I want to punt those. They're giant rats. They're just big rats. That's not a dog. No,
So you agree Chihuahuas, not dogs?
no.
Subspecies.
Yeah. I like the Irish Wolfhound.
Okay.
That's a big one. I like that one.
I'm a Newfoundland fan.
Okay.
Big
We,
and fluffy.
yeah, we like big dogs.
Excellent.
We've got 27.
Dogs?
Yeah.
I just keep bringing them home.
You just follow her.
I take treats with me everywhere.
And the other humans that you are coming across who also have these dogs, what is your relationship turning into with them?
Oh, I eat them.
That's what the dogs talk about.
Is that not etiquette here?
So the humans might not like it, but as a thought form from a different plane of existence, I think you might be my new favorite thing in Earthrealm.
Fantastic! I have a friend! Yay!
Long distance relationships, certainly, because they only let me here once a year. I'm conjured.
That's fine. I can only stand people for a short amount of time anyway. Before I want to eat them. He's some strange sort of exception.
But from what I can tell, you do eat him just fine.
I do. He likes it. Isn't that right, honey?
So
Yeah.
speaking of liking it, onto the third viral infection. It's HIV, human immunodeficiency virus. It is the virus that causes AIDS, acquired immunodeficiency syndrome. This particular virus is responsible for the attacking and breaking down of the human immune system, which is how mortals here fight infectious diseases.
Oh, okay.
And so without an immune system, you are defenseless against things like the common cold, influenza, coronavirus, all those things that are floating around out here waiting to do the human body damage. The body's left defenseless against it. And so that is what's very dangerous about that. That one, HIV, is only transmitted, however, from 4 fluids: blood, semen, vaginal secretions, and breast milk. And so barrier methods like condoms, female condoms, do a great job in preventing the transmission. So condoms are 99.9% effective. And then moving on, we were talking a little bit earlier in the day in some other sessions about this new, well, not new, but like this treatment or medication, or I call it a whole vitamin really. It's called PrEP, pre-exposure prophylaxis. And it's for people who do have a high-risk sex life. They take the medication once a day, and it prevents the transmission of HIV if you don't have it. And so that is a realistic option for people who do really enjoy sex. And there are things that, like no judgments. There are things that you can do that can increase your risk for an STI, and there are things that you can do to decrease your risk for an STI. And multiple partners, like 90 partners in the past 90 days, like 1 partner a day, is something that can increase your risk. Now, I'm not going to tell someone to stop, right? Anyone who's having sex once a day, get it. However, what choices do you want to make? What do you want to do to make sure you and your partners are as protected as possible?
Sounds like a good option. What are the risks for taking PrEP?
Oh yeah. So PrEP is in its second phase now. So it used to come in a pill called Truvada, but now it comes in a much smaller pill called Descovy. And of course, there are side effects related to bone density, related to liver functioning, some stomach aches. And if you do want some like detailed information about PrEP, we can actually have an entire session with a PrEP counselor. PrEP is something that I will recommend for someone who is having, 3 to 5 different partners in a week. If you're having sex with people and you're not asking their names, if you're having sex with people in exchange for drugs or money, if you are having sex with people after you win big tournaments as a way of, getting victory. So you are a victory sexer.
Orgies.
Orgies.
Oh, so many.
So many.
Yes.
In both of your tents.
Yes.
It's crazy.
Crazy. So orgies is an example of something that could be a high-risk activity for contracting an STI, especially if there are people there that you don't know.
So many.
And people there where you don't know their status, like if they have an STI or not. And so that would be a great place to have bottomless condoms.
Like a bottomless pit full of condoms?
Yes.
That's a lot of condoms.
That's probably go empty.
Probably, yeah.
With an immortal and a once a day,
Once a day?
90 partners in 90 days. It's 1 partner a day.
That's just for now thing.
Oh.
That doesn't lowball the numbers.
Oh, yeah. The 90 partners is definitely more than one a day.
Excellent. I'm all about the healthy, consensual, positive sexuality. So all the things that you were sharing with me here do not bother me in the least bit. But my concern is to make sure that you're both protecting yourselves and each other. So high-risk activities are the activities that bring you into contact with those 4 fluids. So when it comes to the bacterial infections, they can be transmitted through saliva as well. You can transmit herpes through kissing. Yeah. So if you have a sore on your mouth and you kiss someone, they can catch it. If you're shedding in your mouth and you kiss someone, they can catch it. And so if you do have herpes or if you contract herpes, you can take Valtrex, and it really kind of adds an extra layer of security, peace of mind.
Okay.
Yeah. So bacterial infections, condoms, viral infections, and sex acts. Those all kind of dovetail together to create a situation where if you're not operating in accordance to your values or you're not being very mindful, you're going to end up making decisions that do put you at a greater risk. So oral sex, it's the oral stimulation of the genitals. That is a low-risk activity for contracting HIV.
Yeah, okay.
Thank God.
Any other sex acts that you've heard of that you are questions about?
What about butt stuff?
Butt stuff. So personal question, do you have an anus?
Yes.
Yes. So butt stuff is an elevated risk. So when it comes to anal sex, especially inserted with like a penis or like some other objects that you might want to put in there, there's the risk for fissure tears, micro tears in the lining of the anus that leaves you open and exposed for blood, which is one of the ways that you can transmit HIV. And so if you're having unprotected sex in the anus, you are now mixing in 2 of the fluids. And the same is true for vaginal sex, right? Vaginal secretions transmit HIV, and so does seminal fluids. So there would be an elevated risk, the presence of 2 fluids. And so if any of these were to get into your blood, like during a fissure tear or during menstruation during vaginal sex, actually, do clones menstruate? Bleed from either vagina?
Never happened to me before.
All right, so then menstruation from a human standpoint might not be a thing for you, but blood and coming into contact with that during sex, which actually might be something that you like, does increase the risk in the mortal realm.
Okay.
Any other sex acts?
So if she pegs me, does that put me at risk?
Yes.
For the anal sex thing, for her, like,
So if she pegs you in blood,
yeah,
does that put you at risk for HIV?
correct.
Not if she is not with the seminal fluids or inserting any blood.
Okay.
Good question. Good question. Any other questions about sex acts?
No, I feel a little bit safer. I feel a little bit more confident that I'm gonna take him home and ride him till he dies. And then I'm gonna start his heart and do it again.
Excellent. Excellent, excellent. So have either of you ever been tested for any STIs before?
Like
I
once after a crazy ex.
Once after a crazy ex. What kind of test did you have?
Shoved a tube down my dick.
Oh, dick tube. All right. So when it comes to being tested for HIV, there are a few options. You can get an oral test, which they swab the inside of your cheek and there's some activator and does the thing. And then there's also a finger stick, which does blood. So a lot of folks get confused. They're like, if you can't transmit HIV through saliva, how can you test for it in the mouth? That would be a great question. So the answer is these tests do not actually look for the virus in your body. It looks for antibodies that your immune system produces. And the presence of those antibodies is what leads to a positive test. There's HIV-1, HIV-2. There are tests for both. Tests take about 20 minutes, so they're pretty rapid. And there's a window period of about a month, which is actually drastically shortened from when it used to be. And then there are some tests that do have it shorter still, but I always tell people the test that you take today tells you everything before 30 days ago. So anything from within the last month is still kind of spotty. Come back for another test in a couple of days if there's anything that you're really concerned about. When it comes to situations where you're not quite sure that you want to be doing insertive sex, like vaginal, anal, oral sex, there are things that you can do to continue having a great time with the people that you are with while also reducing the risk. Do y'all have any idea what those things could be? Y'all started this session by talking about it a little bit.
Talking about
The hand stuff.
the hand stuff.
The hand stuff is a great thing for y'all to do. And it sounds like you might have to use both your hands.
Hey, it is what it is.
Yeah. But just be mindful that there are things that you can do, and you both seem very open-minded, which will be super helpful for you in the exploration process. The other thing that I do want to make y'all aware of is communication around boundaries. So maybe how much cutting is too much cutting, how much dirty talk is too much dirty talk, how many partners are too many partners, or not enough, or what have you. And so the point here is not to have discussions that limit you, but clarifies exactly what it is that you want and what you're looking for. Because communication is one of the biggest ways outside of abstinence to reduce your risk for any unwanted illnesses.
Okay.
So rapid test for other STIs like gonorrhea, chlamydia, syphilis, blood, and urine.
Okay.
And they can all happen at the same time. It's like a panel. And if you decide that you do want to get a test before you have any more sex, I can send you to the clinic. They can do it all in the same visit. They can take you both as couples if you would like. And then their policy is if you don't hear from us, you don't have anything. And that's generally how it works. Because working, treating, counseling on STIs, even contracting STIs is so common that kind of like the workaround, the participation in the treatment and getting back to your life is relatively minimal.
Okay.
Any questions?
When can we get tested?
So if you want to, I can call and get you an appointment for as early as tomorrow at around 10:30.
Sure.
Tomorrow at 10:30?
Sounds good to
That
me.
sounds good.
Excellent. I will go ahead and make the call. I will put that stuff in, and then you can come right back to this spot tomorrow. I'll have the testing counselor ready for you. Thank you so much for coming. It is not every day that a thought form gets to do STI counseling with other realm beings, and it really just makes the word go.
I know, right? I like you. We should hook up sometime.
No. All right, folks, have a nice day, and I will see y'all tomorrow.
All right, thank you.
All right, have a good one. All right, now to call my friend back.